Hello, everybody. My name is Alasia Young, and I'm presenting my APE final presentation. So to introduce you to what I have been doing in my internship, I was with the organization Osage Foundation. They are a nonprofit public health organization geared towards encouraging and promoting holistic remedies and lifestyles, um, mental wellness, and vegan lifestyle. My role was a public health intern, and my supervisor was Crystal Rylowitz, who is an executive board member of Osage Foundation and also the lead supervisor of the public health sector. And my organization or my internship was hosted in a remote setting, but the organization itself is based in California. So my major work's accomplished. I had two major products that I made. Um, the first one was a program proposal empowering Black maternal health. This program was a development to bridge racial inequity gaps in morbidity and mortality for Black mothers and infants. To the right is a screenshot of the title page. So just to be more specific, the title was Empowering Black Maternal Health, a comprehensive program to reduce disparities and improve outcomes. Um, and then the second piece was a brochure on empowering Black maternal health. And this was a supplemental material coinciding with the program proposal. So activities completed, program proposal inputs were platforms such as Canva, Google Docs, EW Library, and other research platforms. Activities completed throughout this was creating educational materials, training healthcare providers, policy proposals, and hosting seminars, and then also monitoring and evaluation tactics to ensure that the program is effective. Again, this, just to clarify, this is hypothetical. This wasn't actually implemented. This was just a proposal. The outputs include implementation strategy, public awareness materials, and educational information. And then expected outcomes were increased education and awareness in Black mothers, reduced bias and discrimination in healthcare settings, improved Black maternal health overall, and decreased Black maternal morbidity and mortality by 25%. And these outcomes, this program proposal was geared to be implemented over the course of 5 years. So within 5 years, the ideal percentage decrease for Black maternal morbidity mortality by 25% was to be met over the course of 5 years. And then the brochure, this is again complementary to the program proposal. So the inputs were things like Canva, EW Library, and other research platforms. Activities were promoting the program, encouraging engagement, and organizational promotion. Outputs were the call to action tasks. So things like reaching out to our email and our phone number, creating public awareness, and provision of significance. So in other words, just providing data and statistics on why Black maternal health is so important, why we were empowered or inspired to create this program geared toward Black mothers. And then our expected outcomes were increased engagement, enhanced awareness, and empowerment to become their own adversaries. So this is the title page of the brochure. On the right-hand side is the title page, and we use things like imagery and other terms that target our audience specifically to ensure that, hey, this information is specifically for you. And then the left page goes over just a little bit of information why this movement is so important. And then the middle page talks about our program itself, what our goals are, and why we're doing what we're doing. The inside panels, the left-hand side goes over some more statistics. So Black women are 3 to 4 times more likely to experience death and disability rather than their white counterparts. And in death and disability, we use those terms instead of morbidity and mortality, just to be a little bit more inclusive in everyone who might be at different health literacy levels. Things like social determinants of health, higher risk of pregnancy complications for Black mothers compared to white mothers, and then the mention of systemic racism and how that plays a huge role in why we have health disparities in Black maternal health today. We go over common challenges just to kind of create that safe space of feeling heard and feeling welcome to share your stories and to share your challenges. Um, so things like feeling safe and heard by your care physician, not having accessible transportation, nutrition, or living in unsafe environments. Other things like not wanting to go to the doctor's office because of fear of discrimination or previous discrimination and bias that led to an unpleasant experience. And then just overall systemic racism, racist hospital practices like excessive drug testing in Black populations versus white populations. Um, and then further down, we just kind of add those encouraging words like, become your own adversary. We're here to help you. We're here to help you get to resources that you need. What we ask from you in return is that you just tell others about us and you tell others just, other Black mothers who might need that assistance, that there are resources out there. And then to the right, these are, quote, our partnered organizations. And these are real organizations that are specifically geared toward Black maternal health initiatives as well. So these are the CPH competencies that were met by my project. So EW1, utilizing the health impact pyramid in conjunction with social behavioral theory or models. And we'll see that in a few slides, examples of the health impact pyramid and the social ecological model. C7, assess population needs, assets, and capacities. So this were things like in the beginning of the program would be a implementation of a needs assessment, followed by piloted programs, followed by monitoring and evaluation, or just evaluation tactics just to improve based off the results of those piloted programs to then further expand beyond what was first implemented or where it was first implemented. C9, design a population-based policy and program, project or intervention. So again, this is just the general proposition of the proposal. So it included, really important aspects to any program proposal, things like the implementation strategy, which breaks down each goal, each objective, and each expected outcome, and gives you a timeline of when that's supposed to be completed. It also includes the logic model, which breaks down, again, the inputs, outputs, activities, and expected outcomes, and then the budget proposal. So that is a breakdown of each piece and resource that may be needed throughout the course of 5 years and what we expect those things to cost, and then briefly describing what funding sources we will be pulling from. C8, the apply awareness of cultural values practices to the design or implementation of public health policies or programs. So C8 was met by the brochure, and this was because cultural values and practices. This was why this was met by mentioning that systemic racism is a huge role in the health disparities of Black mothers, and how there are health disparities that exist between, for example, white mothers versus Black mothers, and how Black mothers are 3 to 4 times more likely to experience death and disease related to pregnancy or death and injury related to pregnancy rather than white mothers are. And then also things like imagery, just using imagery to help target to our ideal audience. And then C14, advocate for political, social, or economic policies and programs that will improve health in diverse populations. So again, this was met by the program proposal, and this was met by the advocacy section where our form of advocating for Black maternal health improvements is through policy proposals. And so examples of policy proposals that were mentioned in the program proposal were things like healthcare coverage, expansion for midwives and doulas, and then also healthcare expansion for behavioral and mental health. This is more for like postpartum healthcare. And then also policy implementation of paid family leave and some type of mediation for childcare costs. Okay. Okay. So Exhibit A would be just to kind of back um, to kind of coincide with the EW1 competency. So this is the health impact pyramid. It starts from, the largest impact and goes all the way up to the smallest impact. Largest impact being socioeconomic factors. Second being changing the context to make individuals' default decision healthy. Third, long-lasting protective interventions. Fourth, clinical interventions, and fifth, counseling and education. And then to the right, this column, each piece coincides with each level of the pyramid. I won't go into detail about it, but it kind of just provides a little bit of information about what exactly the program will be focusing on in their educational trainings and their workshops and their seminars to improve awareness and improve Black maternal health overall. And then this is the social ecological model. Again, this is just a breakdown of each level of the model and how Black maternal health is affected, to say the least, by each level. So interpersonal, intrapersonal or individual bias, racism, beliefs, feelings, attitudes, things like that. Interpersonal being how you interact with, another person, bias, discrimination, personal bias and discrimination. And that comes with the implicit bias in healthcare settings from doctors. Organizational, so and then you'll have your organizational level, your community level, and then public policy, which is more what we would address through our policy recommendations. So to conclude and reflect, I can definitely say that this experience has provided me with hands-on experience and has allowed me to apply theoretical skills to practical situations and managing products. It has encouraged me to make adjustments to new environments and forced me to meet deadlines and apply skills to create tangible results. It also enhanced my ability to synthesize complex material into user-friendly formats and equipped me with fundamental skills, allowing me to establish groundwork and establish networking opportunities. Throughout this process, I've identified strengths and weaknesses that will enable me to progress my professional growth. An example would be strengths in research and communication, and weaknesses being time management. And then overall, I definitely would say that I have a reinforced desire to concentrate on specific public health topics, such as Black maternal health. I feel like this project I was very inspired by, and just feeling very passionate to delve into, the background on Black maternal health, why we have such large health disparities today, the history behind it, and it's all very important. And at the end of the day, I'm just grateful to have been a part of this process. So thank you for watching my presentation. And that is the end. Thank you.